everyone, I'm Liz with 9 Health, and joining me today is Dr. Stacy Brake, Stacy Brake, our co-director of Health and Wellness, and Dr. Karen Polsky, who's board certified in internal medicine. I was gonna combine you guys into one person.
Into one person?
Because that's,
yeah.
That's apparently what you do these days. Anyway. So, sorry about that. It is Health Happens, our weekly Facebook Live show where we talk about all things health. And in case you missed the big announcement last week, our website, 9healthfair.org, we have all the fairs up, so you can go, check it out, find a fair near you, register for a health fair, and own your health. So we are very excited about that. And with that, we want to talk about the screenings that are related to cancer detection. So we have 6 screenings that can help identify whether or not you might have cancer, and early detection is key. 5 of those screenings are free, only one cost. That's our colon cancer screening kit that you can get. And so let's start talking about that one first. Stacy, why don't you tell us a little bit about the colon cancer screening kit?
Sure. The screening kit is really super easy to use, and like Liz was saying, early detection, especially with colon cancer, is the best thing to do. So this kit, it's a take-home kit that you get at the health fair, and you take it home, and after one stool sample, you take a collection of that, put it on this card, mail it in, and we take care of the rest, and we'll send you the results. If it's abnormal, we call you. And it's really super easy to use. I don't know why I keep saying super to use, because it is super to use. And the instructions come with it on how to use it, and so it's just really a great screening.
Yeah. And Dr. Karen, who might want to take advantage of this screening?
The recommendations right now are start colon cancer screening at age 50. And stool testing for blood is one of the components to that, as well as colonoscopy. But what I'd say is it's really important that you know your family history. So asking siblings and parents if there's any colon cancer in the family, because if there was colon cancer or polyps, you might actually start screening earlier, usually 10 years before that diagnosis.
Okay.
So that's a good conversation to have with your doctor about what's the optimal time. And the other thing is to know that if you have symptoms, changes in your bowel, you should also talk to your doctor. But this is a great way to screen for colon cancer. And colon cancer starts as a little polyp, which can be a little bit of blood. And so when detected early, it can be cured.
Right. So early detection.
And the great thing about this kit that we use is it only detects human blood. It does not detect animal blood, so there's no dietary restrictions before doing this, taking the sample.
Oh, that wouldn't have even occurred to me. Okay, that's good to know. Great. Okay, well, you can still eat whatever you want.
You sure can. You sure can.
All right, Stacy, let's also talk about our breast cancer screening.
Yeah, that's a great screening and recommended for all women. And it's at a large amount of our fairs will offer that screening, and practitioners will come in and volunteer their time to do breast screenings, like the self-breast exam that you do at home that we all should be doing. They will do that on participants at the health fair, and they will also give some education about how to do the screening themselves and what they're looking for, and time recommendations on that, like yearly and stuff like that.
Okay, great. And I think, Karen, it's important to talk about, men can get breast cancer too. At what age should men and women start screening for breast cancer?
Okay. Talking about screening, the big thing about for self-examination is to know your body. And recommendations are generally around age 20, and that's kind of when your kind of breasts have changed. It's just to start knowing your breasts. Look in the mirror, know what they look like, the shape of them, know how they feel, and kind of monthly how they change. And those are the recommendations as far as kind of breast screening. And I think at the health fair, the nice thing is that if you don't know your breast well, just to feel comfortable with that and have someone walk you through it and tell you what's normal and what's not normal is really helpful. And that goes for men and women. Breast cancer males is just a small percentage. And you'll hear me repeat this again and again. Really important, male or female, to know your family history and to know what runs in your family, all cancers, and now we're learning that some cancers are associated. And talk to your doctor about that, because you might start screening early. But as far as examination, get to know your breasts.
Yeah. All right.
Yeah, and at several of our health fairs, the practitioners, sometimes we get feedback. They have worked with our participants, some women, and they have found lumps and referred them on to get further to talk with our healthcare provider and get further testing.
Yeah, I remember we did a Facebook Live with one of our breast cancer screeners. I want to say it was like maybe 6 months ago or so. But she was talking about how at each fair site she goes to, she finds about 2 lumps. Now, just because there's a lump, it doesn't necessarily mean it's cancer. It could be something else. But still, it's good to get that checked out and make sure.
Absolutely.
So we also have our skin cancer screening, and Stacy and I were talking about this the other day, where it's like, I think a lot of people think you have to go into the room and get naked, but that's not necessarily exactly how.
It's not necessarily. You don't have to do that.
So don't worry about that. But, if you go in and you have a spot that you want the examiner to look at, they can take a look. So what, when people are looking at their skin and just checking it out for signs of skin cancer, what should people be looking for?
So this, again, like Karen has said, is knowing your body. So I think it's like a really good start is to have a professional look at your body first and then kind of show you what everything is, so that way you can continue your skin exams and keep looking, for any changes. If you have moles, such as birthmarks or just little moles that we have, if those start changing or growing or hurting, itching, then that's certainly something that somebody will want to point out to a screener or to their own provider. Other things to look for are not necessarily the dark ones that we get with moles and birthmarks, but like the light ones that are scaly. They might, some of them look crusty, some of them look kind of angry. And those are certainly ones that want to be looked at as well.
And this is, again, it's a free screening. So, if there is something you're worried about, you really want to come on by to 9 Health Fair and take advantage.
Yeah.
And I say, even if you're not worried, just to have someone, when you're looking at your moles, on your own body, because we all look at pictures, but on your own body, to have someone look at a normal mole and say, see, it's normal because this one. And so when you see other ones on your body, you can compare it to a normal one. Like, oh, this one's normal. This is why it's different. So even if you're not worried, just to get some parts of your body checked.
Especially like your back, because we have, we can hold mirrors up and stuff, and that's great to do, because if you can get close to a mirror on a mirror, you can see if changes are happening. But sometimes it's far enough away that you really can't see that. So at least once a year, having somebody take a look at your back and looking for changes.
They have found that if you have a significant other, that looking at each other.
Yes.
So women are actually tend to be better at looking at their significant others for mole changes, but do it as a team. And get to know each other's bodies and moles.
Yeah, no, I think that's a great idea, definitely. All right, and Dr. Polsky, who is most at risk for developing skin cancer?
Right. Well, one thing, we live in Colorado, so we are closer to the sun, and UV exposure is high, and we all like to be outside, right? So we like to hike, we like to be on the snow or water, and certainly UV exposure puts you at risk for cancer. And I think one important thing to know is that 80% of our sun exposure is just incidental. So that's walking to the car or the grocery store. So while we might think, oh, I'm going skiing, I'm going to put sun cream on, we're not. We all really need to be good about in Colorado about putting it on all the time.
All the time.
But other risk factors, family history, very important. Smoking is important.
Interesting.
Yeah,
with skin cancer, okay.
Yeah, and then there's other things like if you're immunocompromised, and there's certain diseases that are kind of correlated with that. But what I'd say, certainly here, we're all at risk. We all get a lot of sun exposure. We forget to put sun cream on our ears, or our backs, or necks, exactly, or scalp.
Yeah, I was gonna say the scalp. That's always what I'm worried about. Burning my scalp, and then it looks like I have dandruff.
And then also, light skin.
Yes.
So red hair, blue eyes. Yeah.
Yeah. Yes. All right. So
back on that skin cancer, I think a great place to get some information and pictures and stuff is the Skin Cancer Foundation. It's a nonprofit organization that has great pictures on their website that you can print off and then have pictures to compare different things. Because we're looking mostly for things that just don't look. They're not the same, right? Like Karen was saying, one's a circular, and then one might be totally a different pattern.
But I say certainly, whenever come to the 9 Health Fair, get things checked, and if you're worried, go see your doctor or dermatologist, and it's an easy check.
Know. It's better to just know. Just know, and then you can deal with it and be done with it.
Yep.
Exactly.
Yep.
So I want to also talk about our Pap smear screenings that we do, and I think it's important to let you guys know that all of these medical screenings are done by medical professionals who
Yes, they are.
volunteer. Yep.
Yep.
They volunteer their time to the community, so it's not just some random person doing these screenings.
No.
No, it is a medical professional who knows what they're doing. And Stacy, you make a lot of calls throughout the health fair season to women, letting them know about abnormal Pap smears. You know, how prevalent is that? How often should a woman go in? Because I feel like it's changed from year to year.
Yeah, there's different guidelines on having a Pap smear screening, and I'll let Dr. Karen talk about that. But last year in 2017, we did about 670 Pap smear screenings, and of those, 65 of them were abnormal. So we called the participants on those and talked to them about the abnormality and how they really need to follow up with that.
Yeah.
Because any abnormal in a Pap smear, that could become it could be precancerous or turn into cancer.
Yeah, and what I just say about cervical cancer is the screening. It's really good. So if it's abnormal, you can actually get it fixed
Yeah.
and not go on to cervical cancer. And so it's really one of our, just a great screening test.
Sure is.
And I think it's with the 9 Health Fair, if it's abnormal, they're doing HPV testing. And what we know about cervical cancer now is that HPV, which is a virus, is associated with most cervical cancer. So if that would show that you're at high risk, you might have increased screening. And if it shows that you're not high risk, so you don't have the virus, then you might be able to space your Pap smears out further.
Okay, all right. And then we also have our oral screening. Dr. Polsky, what are dentists looking for when they are looking into your mouth for cancer?
And it's good for you to know, because you should get to know your mouth.
Right.
But looking for areas, sometimes white patches that don't go away, areas ulceration that's not healing, red areas, lumps, or things like that.
Okay.
And what I'd say with oral cancer is definitely associated with tobacco products.
Yeah.
And so smoking, chewing tobacco, cigars, probably vaping as well.
Yeah.
But we also know it is also associated with HPV, which is a viral infection that is
Okay.
really common, that most people have been exposed to. And so even if you're not a tobacco user, it's
Right.
good to actually get to know your mouth
Yeah.
and get it checked.
Yeah, know your body, right?
Know your body.
That's our
That's
theme of
totally
today.
the theme.
And,
yeah.
All right.
and let our 9 Health Fair volunteers help you
Yeah.
get to know your body.
All right. Well, thank you, ladies, for joining us.
Thank
you
you.
to all of you for joining us. Don't forget, you can find a fair near you online, 9healthfair.org. Just click on Find a Fair and put in your town and find a health fair in your community. So thank you again for joining us, and we'll see you next week.